And relax.
ForceWIN10 uses a little brawn to assess the brain.
And relax.
ForceWIN10 measures muscle force in the jaw, mouth, and fingers to evaluate the health of the brain. The system can be used to diagnose and treat conditions ranging from stroke and traumatic brain injury to Parkinson's and ALS. ForceWIN10 originated in the lab of University of Nebraska researcher Stephen Barlow.
It allows us to examine the strength of these muscle systems, but more importantly, this system allows us to understand how these muscles are controlled at precise force levels that you need for manipulating objects, for generating speech, for eating, facial gestures. It can also be used as a system for therapeutics.
The wireless instrument includes a double-sided mouthguard that measures jaw strength, a second force sensor that measures movement of the upper or lower lip, a third instrument that samples the force of the tongue, and a small button that can be pinched to measure force in the fingers.
So with this one instrument module all interfaced to this computer by way of Bluetooth technology, we can sample 4 different orofacial structures. It takes approximately 6 to 7 minutes to do a diagnostic assessment for any given structure on this computer program known as ForceWIN10.
The system is set up like a video game. Patients try to generate the appropriate level of force needed to reach a target on the screen.
There's this red line, and this is your target force. So when you hear the beep, you are going to apply force with your lower lip and reach that red line as rapidly and accurately as possible.
A test of an adult stroke patient indicates the damage to one side of the brain affects strength in the opposite finger.
In fact, this patient is showing an overshoot roughly 8 times the target. And you can also get a sense for the instability in this force contraction.
Information collected from patient testing answers a variety of questions. How fast do the muscles contract or relax? How long does it take them to fatigue? Therapy can be tailored to meet individual needs.
We can turn the system around and use it for neurotherapeutics to help prescribe a treatment program for these patients as they go through motor rehabilitation.
So you're just going to pinch, and then when relaxed, you just let your hand open.
If we determined that most of the impairment was in the hand or the fingers, we can design a very specialized motor feedback program using ForceWIN. It operates much like a video game in which the patient is able to see his or her own force signals in real time, and they get an opportunity to practice and repeat force productions at different target levels. And it's this practice effect that stimulates the brain and helps it to establish new connections and improve their motor control.
The ForceWIN10 system is cost-effective and accessible for clinicians in physical therapy, speech-language pathology, even dentistry or maxillofacial surgery. It can be used on patients beginning at about age 5.
And for the very first time, we'll be able to get bedside with acute stroke. So these are patients that have sustained the injury and the infarct within a matter of hours. We'll be able to start assessing and formulating diagnostic and therapeutic plans for these patients.
Nationwide trials with ForceWIN10 will include Madonna Rehabilitation Hospital in Lincoln and the University of Nebraska Medical Center.